Many people ask, okay, regulatory and policy sounds powerful, but how do I actually enter that space as a young pharmacist? That's a very good question. Let's make this practical because this is not a space you enter by accident. You don't just stumble into it. It is very intentional. First, you need to understand what regulatory and policy actually involves. It is not just sitting in an office writing documents. Perhaps that might be what someone told you. It includes drug registration. It includes inspection and compliance. It includes policy drafting. It includes health systems planning. It includes governance. It includes health technology assessment. So before you apply anywhere, I want you to ask yourself, do I genuinely enjoy systems and structure? That's an important question that you need to ask yourself. Do I genuinely enjoy systems and structure? So if your answer is yes, then step two begins. And in the second step, we talk about positioning yourself early enough. You begin positioning yourself early enough. So while still in school or during the internship period, volunteer for committees, join policy discussions, engage in professional associations like Pharmaceutical Society of Kenya. It's an umbrella body for pharmacists here in Kenya. Attend regulatory forums. We have RAPS Kenya, Regulatory Association of Pharmacists Society of Kenya. Attend regulatory forums that are organized by RAPS. Read policy documents, not just textbooks. Read policy documents. Most young pharmacists, they only read clinical guidelines, perhaps because maybe they found roles in clinical setups or they're in the internship period, but very few read health policy document. That difference really matters. The third step that you need to consider is to build the right academic advantage. And by this we mean regulatory and policy roles, they favor additional qualifications. For example, Master of Public Health or Masters of Science in Public Health, Health Economics, Policy and Governance Studies, Regulatory Affairs certifications from organizations that offer them. And you don't need all of them at the beginning, but you need something that will signal, I understand systems, not just prescriptions. The fourth step that you need to take is to get exposure, even if it's unpaid in the beginning. So apply for internships at the Pharmacy and Poisons Board. You may visit them and find out if they have any internship opportunities for you. Apply for attachments at the Ministry of Health, where you can learn policy, especially public health policy. Apply for attachment in county health departments. You can volunteer even for certain roles just to be able to learn what happens there. Be a research assistant. Apply for research assistant positions in policy-related projects, because exposure will build your credibility and credibility will open doors for you. The fifth step is to develop analytical and writing skills, because policy is written, policy is analyzed. So you need analytical and writing skills. Policy is not just about argument, but it's argument that is backed by evidence. So if you cannot write clearly or think critically and interpret data, you will struggle in this space. So start improving that as soon as now. And the sixth step that you need to take is to network strategically. Network strategically. Most regulatory roles that, of course, they're out there are not widely advertised. They are very competitive and they often require internal awareness. So attend professional meetings, introduce yourself confidently and express interest in such positions. Then make follow-up after you've networked. Now, here's the reality that you need to have in mind. Regulatory and policy is slower growth compared to sales. Of course, I did a video on sales before, so it's slower growth compared to sales, but it is high impact influence. You shape frameworks, you influence legislation, you strengthen systems. That is a system in organizations where you work, and also systems that can impact the outcome in a patient's life. So, or in patients. And over time, you become part of national decision-making structures. So if you are a young pharmacist wondering how to enter regulatory and policy, I want to encourage you that you start early. Position yourself intentionally, build the right skills that are needed for those roles, and seek exposure. Think systems. because the pharmacists who shape the future are not only in hospitals. Some are in boardrooms. Some are in committees in professional societies like Pharmaceutical Society of Kenya. Some are drafting the policies everyone else follows. So I want to challenge you. This is a very good path. If your skill set match what the role demands, please go for it, and you can begin building that as early as now. See you in the next video as I share on top 5 common mistakes that pharmacists who intend to step into regulatory and policy space make. See you in the next video.